As we age, our skin and tissue lost their elasticity and start noticing wrinkle and sagging. Hi everyone, I'm Queenie from CloudHospital TV. And before we start, please subscribe to our channel so next time you'll be updated with our new releases. A facelift, or radiectomy, is a cosmetic procedure that tightens up the sagging and wrinkled face tissues. It creates a younger look and lessens the sign of age on the face and neck. The procedure usually focuses on the lower two-thirds of the face, and sometimes the neck. During a facelift, on each side of the face, a flap of skin is pulled back. Then, the tissue under these flaps is altered to regain a youthful contour and shape of the face. However, a facelift surgery is considered a restorative surgery, so it cannot change the fundamental shape of your face or stop aging. Instead, it can bring back a more youthful appearance. So as a quick recap, a facelift will help reduce the sagging appearance of your skin, reduce excess skin at your lower jawline, remove excess skin and sagging folds of your neck, and restore youthful appearance. Currently, there's a new techniques in facelift surgery known as SMAS Facelift. So what's that? SMAS stands for Superficial Muscular Aponeurotic System, which is a layer of tissue deep within the skin. It is considered one of the most important supportive structures in the face. Any change of results in a change of facial appearance. SMAS facelift targets the lower two-thirds of the face, and they also, just like regular facelift, adjust sagging skin, excess fat, and loss of volume of the cheeks. However, they're not as invasive as regular facelift. SMAS facelift targets specific goals in restoring young facial appearance, including midface sagging, hollow cheeks, sagging fat, jowls, sagging nasolabial folds, and loose skin or fats under the jawline or chin. So who's a good candidate for SMAS facelift? If you're over 50 and in a good health, and still have some elasticity in your skin and you want to correct the sign of aging, you're a potential candidate. An incision is made at the temple above the hairline, then it extends down natural creases of the skin, but curved behind the ears. Then, the surgeon will lift and rearrange facial, neck tissues, and muscle beneath the skin into a higher position and remove excess skin. Our role today is to answer your question regarding SMAS facelift surgery. Today, we have Dr. Kim. He's going to discuss with us everything about SMAS facelift from an experienced medical point of view.
Hello, I am Dr. Kim from BK Plastic Surgery. Nice to meet you.
So our first question for facelift would be, how many kinds of facelift are there in Korea?
As far as facelifts, SMAS, Superficial Muscular Aponeurotic System, is a technique to fix and rearrange the sagging skin areas such as the eye area by pulling and setting to reduce sag. Depending on the focus point, there are a variety of techniques. So many doctors have their own unique techniques, so it is difficult to explain all right now. But focusing on the main incision methods, we could say that it can start from above the ear line to the lower hairline to adjust in front of the ears and below.
What's the difference between those two that you have mentioned?
Well, for the full incision method, we can lift the middle face and lower face, including the jowls, while the limited incision method could only lift the middle and lower face area.
So how long does a SMAS lift last?
Generally speaking, many say a facelift lasts 10 to 15 years, but aging does not stop post-surgery. So when about 10 years pass, the patient also aged 10 years. So it is best if one undergoes additional surgery after that. Getting a facelift does not equate to getting 10 years younger. But when compared to the same age person who has not undergone a facelift, the one with the facelift clearly looks younger.
So what kind of clients should have a facelift?
those who lack elasticity in their skin relative to their age, who have sagged skin, for example in their jowls, mouth, neck areas. Also, even for younger patients who have recently undergone sudden dramatic weight loss and thus have sagging skin, as well as those who have undergone contour surgery and need some skin tightening.
What are the side effects of facelift?
In facelift surgery, relative to eye or nose surgery, there is a larger area affected, so there might be some bleeding or thrombosis, but those can be controlled or prevented to some degree by careful control of blood pressure. And long-term, scarring and nerve sensitivity can result. In the case of scarring, we can use triamcinolone or other scar treatment ointments to remedy the condition. And in the case of nerve sensitivity, a more careful surgery technique can prevent such conditions.
So how do clients take care after a facelift?
After a facelift, in order to prevent the unraveling of the threads that are holding the SMAS tissue, it is best to avoid opening one's mouth too wide. For example, when eating or when visiting the dentist. Also, losing or gaining weight suddenly dramatically is also not the best. Also, laser lifting should be postponed about 3 months.
How long will the recovery period be?
First, the main inflammation and bruises should subside in about a week. Also, the scarring should subside within 2 weeks. Thus, after 1 or 2 months, any remaining inflammation should disappear, and the face should look natural. At the start of the recovery, a proper sleep posture and light exercise, for example, light walking, should help to sustain the recovery process.
What kind of person is not suitable for a facelift?
Those who have a very thin face skin, or those who have very thick facial fat layers, while not ideal, can benefit from facelift for a short period, which can be supplemented with fat removal or stronger pull of the SMAS tissue in order to lengthen the facelift effect.
Dr. Kim, a plastic surgeon at one of the Korean's top clinics, adds that while many candidates for SMARTs are those of the older age, many younger people can also benefit. For example, those who recently lost a lot of weight. The procedure typically lasts about 10 years. Most recover significantly within a week or 2 after the procedure, and after 1 or 2 months, all inflammation should subside. He also adds that one should not lose or gain too much weight right after the SMAS procedure. As an important procedure, it is recommended you obtain multiple surgeons' opinions. An informed decision is a smart decision. And if you have any questions or comments, please leave it down below. We'll respond to you as soon as possible. Thank you.